Thank you very much. It's just such a pleasure to have so many of you here today. And I was thinking as you were going through that kind introduction that it was pretty much 30 years ago, almost to the day, that I made a decision right here in Kingston that would forever really set my personal and professional direction. And that was a decision to transfer from political science at Queen's into nursing. And following that path has been an incredibly rewarding one over the years. But I have to say, I really do feel like the past 3 years that we're going to be talking about today has been one of the most incredible challenges and learning opportunities that I've had. And it's been a huge privilege to lead Kingston General Hospital. And what I'm going to talk about tonight is the story of KGH. And it's a story that actually has many earlier chapters. And a number of you have been part of those earlier days with the hospital. And there's a lot of phenomenal things that have happened with this organization over a number of years. And my discussion tonight is going to center on the time that I've been here and then helping us look forward as well into the future about what might be next for KGH and within a changing healthcare environment. The challenges that we faced with KGH that we're all very familiar with actually weren't the first set of challenges for our hospital. And when reading the history books, and it's fantastic because I think, Anastasia, I think you gave me one of those history books early, right when I arrived at KGH. And it talks about when the hospital was first opened, there was no money to run it. And the story of people literally begging others for money. And I thought, some things never change. And, but the challenges that the hospital faced in the early days and throughout many of the years, there have been ups and downs, like almost every other organization. The challenges that were faced at KGH, I think there were some lessons through this time that are very much like some of the lessons of how people tackled challenges in the early days. And some of those are when you've got a group of really committed people who are passionate about what they believe in and about their cause, that anything can happen and people can weather any storm. And so we did need to weather a big storm. And KGH in 2008, I think that was a time where we took a fairly public fall. And it wasn't easy for anybody, and inside the organization or for the community. But I really believe, based on kind of the strong and proud history that the organization's had, and plus looking at change in other organizations, that people aren't defined by whether they fall down, because we all will. But it's about how you pick yourself up and how you stand tall and move forward. That's what defines people's character as individuals and as organizations. And really, the past few years have been about picking ourselves up, dusting ourselves off, and moving forward. And we're now on a very strong and healthy path. And so I'm going to talk to you tonight about some of how that path has been shaped and what we're doing and what's still left to come. I think one of the most fantastic parts of the strategy that we're following at KGH and the path that we're on now is that is a path that's been shaped by many, many, many people, thousands of people, in fact. And even as I stand before you tonight, I want you to imagine that there are 7,000 people standing with me, that we have our physicians, our nurses, all of our support staff. We've got 3,800 staff, our physicians, volunteers, and students, all add up to about 7,000 people every year who are part of KGH and making it happen. So while I have the privilege of telling you the story, it's a story that involves and really has been brought to life by many, many individuals. I think that if we look back at thinking about those that have gone before us and the people that started KGH, right now I think they would be blown away by the fact that we have so many of the staff that we do, the programs and services that Marlene described, and the incredible academic work, 160 researchers, one of Canada's top 40 research hospitals. We've accomplished a great deal. And we know now that there is still a lot left to go. So when we developed the performance improvement plan to tackle some of the really practical, tactical must-dos of getting our organization on track, people really rose to the challenge, got involved, and came up with ideas that we've been implementing over the course of the past few years. But it was interesting in the early days of going out and talking with people. I heard again and again that people didn't want to just kind of balance the budget. That was an imperative that we absolutely had to do. But people talked about the future and what was the future really going to be like and what can we make out of the future at this time. And one of the exercises we did probably about 8 months into the organization, to when I was in the organization, is we were in a room and had all kinds of flip charts. And people started to write, we said, what would the headlines be for KGH in 3 years or 5 years? And there were really some remarkable statements. And I pulled those out again and refreshed my memory even today. And there was the, KGH balances the books, KGH being one of the top employers, KGH spirit soars high, KGH the safest hospital in Canada, KGH the place that everyone wants to be, except even if you're a patient and wanting to be at KGH. I had to think about that comment there, because that's of being a place that you can count on, and a place that you're comfortable, and a place that you enjoy working. And we haven't accomplished every single one of our goals yet, but we are making steady, steady progress. So as the board and I and the senior team and the leaders of the organization worked through to shape a strategy, we went out and I talked to many, many individuals about, again, what KGH could be and what people were counting on us for. And we heard a lot of really frank feedback. And some of those focus groups in the early days were tough, because when you ask people, you say, what do you think? You need to be prepared to take what you get. And some of it was very positive, and some of it was, I want to see the place more clean. I want to see the place, I want to see your infection rates drop because I've heard they're bad. I want to feel safe in your hospital. That was a hard thing to hear. When someone says that they don't feel safe coming to your hospital. But when that is the voice of a patient and a family member who then also say, I am willing to help you move forward, that was an opportunity that was an enormous gift in terms of moving further along into the future. And those early days of consulting with people and going out and listening to what they said, the voice of the people that we talked to really defined the strategy. And we developed the areas of priority for the organization based on what we heard. Because we knew that we were being given a gift of energy and commitment that people had to make KGH the best that it could be. And we've taken that, and now the work has been to translate it into action. We created a strategy that we called KGH 2015 to give us 5 years, and then we'll keep on refreshing to move forward toward our aim of outstanding care always. Outstanding. People don't want anything less, and always, for every patient, every day. One of the things that the consultation period did as well was really, I think, reconnect us with our core purpose. So by involving and engaging so many patients and families in the process of designing who we were going to be and what we were going to do down the future, that voice has stayed with us, and the engagement has stayed with us, and we've made everything in the strategy and everything in the hospital designed to support and enhance the experience of patients, to transform the experience of patients and families when they come to us for care. And so, what did we do? Well, the big areas that we've been working on are in the areas of transforming that patient and family experience by really focusing on quality and safety and service. We've been focusing on how we organize our work and work as teams so that we can better meet the needs of patients and families who told us there were handoffs and they didn't always know who everybody was, and that there needed to be just an overall more coordinated and collaborative team effort surrounding that patient experience. We knew that when looking to the future and to fulfill our role as an academic health science center, we needed to really boost and support research. And if we said that it was important, we needed to really put some stakes in the ground and develop and advance research in the hospital in a way that we haven't before. And also, we needed to be looking at, and we've been focused on, really what is our role in relation to our other partners locally and within the region. And we know that people are counting on KGH for very complex, acute, and specialty care. So while we fulfill our role, and where people are counting on us for that, we need to make sure that all the care is connected in a really seamless way for the patients and families, so when they come to our hospital, they get everything they need and that are well taken care of. And then we also facilitate and enable them moving on to another setting, another organization, and within our partners' organizations in the region, or at home. So with those areas, I'll go through a few of those and then talk about how we've tackled them and what it's taken to actually deliver on those. So when it comes to the transforming the patient and family experience around quality and safety and service, one of the first things that we decided is that building on the learning that we had from all the various engagement sessions and listening to a group of patients, it was about the same time where we were talking to a number of patients actually that weren't very happy with some of the things that were happening in the organization. And their concerns, but their desire as well to translate those concerns to work with us. We created a Patient and Family Advisory Council. And that Patient and Family Advisory Council has been a steady source of advice and hold our feet to the fire to let us know how we're doing as we continue to move through. And we decided to make a real commitment that we are fulfilling right now, that every forum that we have in the hospital, be it a committee, a council, and our task forces and a variety of initiatives, when we have things going on that have a significant impact on the experience of patients and families, we will have a patient or family member at the table. And that's starting to change some of the conversations. Even the language we use inside the hospital starts to change. When you're working with patients and families side by side, you learn as you're talking about some of the issues and the challenges and expressing things in a different way. We use a lot of acronyms. We use language sometimes people don't understand a thing that we're saying. And so by actually having the conversations with the patients and families side by side, it's been a real eye-opener and a learning for all of us. And they're there even in the things that we say, well, that's where we work. You know, you roll up your sleeves and be a patient flow task force and figuring out how to move people through and into beds and out into the community, and we have patients and families that are sitting with us. We've also, it was their brilliant idea, and I just love it, we now have patients on interview committees. So when we're selecting staff, they're helping us do that, because they know it's about the attitude, the professionalism, the interactions that they're having with people, so they've got something to say. And they are just as committed as we are to make sure that we hire the absolute best people in our organization to be there for them at the front line, delivering care or supporting the organization. So having the patient experience advisors everywhere has really been one of the most profound changes. We now have 43 patient experience advisors working with us throughout the organization, and we are growing rapidly with that. The other area that we've focused on a great deal is around eliminating all preventable harm to patients. When people come to hospitals, there's a lot of research that shows, and we know from our own experience, that sometimes bad things happen. Mistakes happen. We also know that just events happen that as a breakdown of communication, planning, and sometimes there are consequences of that for patients and families. So we've decided that rather than hiding from that and talking about it amongst ourselves, that we're opening it up. And we're saying, you know what, we are striving to achieve an elimination, zero harm that can be prevented, so that when people come to KGH, we're doing everything we can to make that happen. The kinds of things that we've been working on toward that aim are things like reducing infections. 3 years ago, we had one of the worst infection rates in a hospital in the entire province. Nothing to be proud of. But what we did was with the help of some outside experts and the expertise of our own staff and people rallying around that as an issue that we really needed to tackle and get better at, we started working on things. You know where we started? Washing our hands. We had a hand washing rate of 34% 3 years ago. Today, I'm very proud to say it is 94% across every category of staff and across every unit. And our Patient and Family Advisory Council was so determined that people should know what the rates are. We've got signs up in front of every unit when you walk in so that you know what the hand washing rate is before you go into that nursing unit and everywhere else in the hospital. So that's been a very positive. We've also done a number of things to reduce infections that a lot of hospitals are working on, including ourselves. Cleanliness. We know environmental cleaning as well is a factor that does contribute to infections. We've put a huge effort on helping to improve the cleanliness of KGH. New protocols, new practices, audits, and a whole variety of things. The other big visible sign at KGH when you come to us now is those carpets are being eliminated. The carpets are disappearing. Yay, I know, that's a very good one. And the carpets, of course, the place is looking better already. It is really starting to look fabulous. 5 of the units are already done, and we've got 4 nursing units to go. And then all the big hallways and everything else. A year from now, you won't see a speck of carpet in the whole place. And so that is a phenomenal kind of change. But even when you're going through all those changes, there's lots of learning and lots of growth, and we continue to monitor and support, and we don't shy away from the fact that when we're not doing as well as we want to be doing, that's okay. We just keep going, and as long as we're learning. The other thing is, even 3 years ago, we weren't able to report to ourselves, to our staff, and to the board, and to the public about how we were doing, because we didn't have the kind of information and the focus on information, using information to improve our performance, to communicate with people, and to help us constantly improve. And so we've also put a great effort on that. We've put a great effort, even as the infection rates are down, our reporting of adverse events is up. This is a good thing. This is because we've actually put in information systems that encourage people and electronically to identify when things go wrong, when there's a critical incident, when there was a near miss of something that almost bad happened that we can learn from. And we review that information and we look at that so that we can continue to improve. So that's a very positive thing in an environment that's striving to be as safe as it possibly can be. We're also working on eliminating preventable delays. So we look at all the times when people who come into the hospital, through the hospital, and then out into the community or another organization. And really focusing in on eliminating preventable delays has been a major effort. The area that's been the toughest has been emergency. The emergency department has been a tough area. But one of the things that has really, when we re-looked at how we solve problems, we thought this is not an emergency department problem, it's a whole organizational problem, and something that everybody needs to be part of to help solve. Because really, it's a symptom of many other things that are going on in the organization. So by not having it as somebody else's problem to solve, but really embedding that is part of an organizational priority, has rallied everybody towards helping to improve this. And so I'm really pleased with the way in which the progress is going. And if you look at the graphs now, the wait times are going down in emergency departments significantly. We've still got work to do, but we're at now about 35% of people are waiting less than 8 hours if they require admission. So it's usually the people who require admission that need to wait the longest to get the assessments and then make sure that we can get up to a bed. And so there's been people that have been working on that with the inclusion of our patient advisors to help put solutions in place that are moving people through the organization faster. And you might say, well, how do you know if you're moving people through too fast? And because we also are working on decreasing the amount of time that people stay in the hospital. Being in the hospital is not where you really want to be for a long time. And yet we need to make sure that it's the appropriate amount of time. And there's a lot of research and evidence to support the amount of time that people should stay in the hospital for particular conditions. So we've been working with the clinical teams and the clinical staff to look at what we call their length of stay. And that they look and say, okay, well, it should be when you come into the hospital, you should be staying for about 3 days. Now, we would look and make sure that combined with the assessment of you as the individual and all the things that go with that, to make sure that we adjust if we need to, but we're actually working toward the evidence that supports that amount of time. And that has helped free up some beds and help move people through, allow them to move into the hospital sooner. Then sometimes we have a challenge that you've read about in other hospitals as well, with people who are in the hospital that maybe could be in a different setting. Maybe they could be in their home or in a long-term care facility, an alternate level of care other than the hospital. So what we've been doing is 3 years ago, and working with partnerships with home care, community care, Providence Healthcare, what we've been able to do is now we used to have 60 patients at any given day or more that were in our beds that really should be, and in their best interest, to be in another setting. Today, we have 22. So we've been able to decrease that, which is a great thing for patients and families, and working in partnerships to help move people where they need to be. The other area around preventable delays and wanting to make sure that we're really fostering part of a system is that we've invested in the continuity of care and the partnerships with other organizations in a very deliberate way. We kind of had a reputation that we weren't always the easiest organization to work with. Sometimes we didn't answer all the calls. And what we've done is really worked on getting to know the family physicians, getting to know the other organizations. And one of the very specific areas of investment that we made was with our electronic communications, so that now about 95% of people who leave our hospital leave with a discharge summary. That's really good. That didn't happen 3 years ago. All the information about what happened to you during your stay, what medications you're on, what information your physicians need to know. Now, about 43% of those folks, the information will be in the hands of their family physician within 72 hours. We are working and have set a goal this year that it will be 100% within that 72 hours, so that we support the continuity of care and the experience, so that KGH isn't a black hole that you go into and then nobody knows what's happened when you leave. And that's a really, really important piece of improving the overall health of individuals as well as the community. So those are all positive things on the patient experience side. Some of the other areas that we've been working on is now when you come to KGH, you're cared for by a team of people. There were always lots of individuals, but we actually didn't have a systematic program that had people working in teams, the physicians, the nurses, the social workers, the patient care aides, and others. And we have a new model of care. And it's an interdisciplinary model of care that has now been implemented across the entire organization. People have all been trained, our residents, all of our staff, and working in new and different ways. And again, the Patient and Family Advisory Council has been central to the design of the model and the implementation of the model that is now everywhere. And I hear from people that it feels different when you go in for an experience at KGH today than it did before. And there are some simple kinds of examples, too, of tools that have been put in place to help the communication and the coordination of care. One of the examples is there's a whiteboard at the end of every bed, and that is, or on the walls, and that was a suggestion from the Patient Family Advisory Council so that they would know who their nurse is, who their physician is, who their patient care aide is, and then a chance for people to leave notes for the team as well if the family came in and out. In fact, with the patient being such an integral part of the team, one of the things in the conversations that started to happen is people said, but we miss each other because we've got all these restrictions and visiting hours, and it all seems to be all really organized nicely for the staff. But it isn't convenient for us as the patient's family at all. And in fact, we want to be with our family, our patient family member, more. So we eliminated visiting hours. People thought we were crazy, that it would be a really hard thing to do because people could interfere with our work. Well, isn't that something? Because our work is the work of supporting patients. So now when you flip it around, and it's really about us fitting in and us supporting the experience of the patients and families when they are here in our hospitals, that's now an open way of working with people, establishing relationships, building trust and confidence. And sometimes it's a little complicated, but we're learning continuously to accommodate and understand the needs of patients and families so that we can better serve them as part of the team and adjust our ways so that we can better serve them. So those are on the team side, that some of the things that are happening. All of the changes that we've put in place have taken an extraordinary amount of energy. And some of that is not just by the changes that have been on the care side, a lot of protocols and procedures and different ways of doing things, because we've really had to come up with a lot of ideas of how to be more efficient, how to use our resources more wisely, how to eliminate waste, how to eliminate steps, how to work together in ways that could make a better use of the resources that we have. And people came up with some phenomenal ideas. And some of these ideas are being implemented in new areas of the hospital and some in our current areas of the hospital as well. On the new areas, I want to talk a little bit about that too, because having the great facilities and equipment are vital for people being able to do their jobs. The facilities that we have at KGH and a lot of the new growth that we've had with the quality of our facilities have been thanks to the tremendous support of government and our community. because we simply could not have had the phenomenal new facilities for cancer patients, patients requiring dialysis, the mental health facilities, pediatrics. It is an outstanding, second to none, first-rate set of facilities. And with all of that came a lot of challenges as you're living through and running 24/7 through running the hospital 24/7 to get everything done while you've got all the construction going on. There were 1,000 shutdowns. You've got to do electrical things and all kinds of ways to support people during those times. But people made it happen. And even when we got into some tough times, we had some floods, we had some blackouts, we've had things go wrong. But always people have stepped up to make it right, and always with the patient in mind at the very front and center. And with the facilities, we've been able to also enjoy bringing in new equipment, state-of-the-art equipment that is now supporting patients and families in those areas. And we've also worked hard to develop the capacity to give our staff and patients better equipment through other ways as well. You know that the aging facilities at KGH, they're really some very, very, very old parts of our hospital. And while that can be charming in the history books, it's not charming when you're trying to work in them or coming into some of the corners of our hospital for care. But we have a plan for some of those other areas as well. First, we're sprucing up the inpatient tower, essentially, as we have now. And that is with the carpets. Not only are the carpets coming out, but every unit is getting painted, and the guardrails getting buffed up. And when you go onto those units now, you can hardly tell whether they're one of the brand new units or they're one of the existing ones. If they really feel like a different place. And so that's positive. We're also working with the staff now, and we're making plans to develop plans for brand new neonatal intensive care unit, new labor and delivery facilities, new labs, and new operating rooms. And so we're planning right now for those because we know that that's the next big set of projects to come. So that gives people some hope, knowing that we've accomplished a major project, $196 million project, on time and on budget, and now we're working toward the next big set of projects going forward. Some of the other changes that have helped both, that have been changes in the facilities as well as changes for staff and patients. As we continue to introduce new technologies of new ways of doing things and respond to the kinds of feedback we've had, we have brand new food systems. So right now the whole new food system, the food system has been completely redesigned. And food was something that people certainly were loud and complaining about, certainly when I arrived, and it's something we've been able to make better. And right now, I can't tell you the positive feedback that we're enjoying and that patients and families are enjoying right now for food. And we just hope people don't get too comfortable and want to stay very longer. But we're really glad that we're being able to serve them well when they're here. And we've got lots of new things for staff, too, for some better food and some better things for them to coffee to enjoy, etc. So let me talk about the finances, because that's certainly been something that has been very front and center for one of the biggest challenges that we've had to accomplish. All the things that I've been telling you about today so far have been programs and initiatives that we've put in place as part of our plan to strengthen KGH and part of our plans to move things forward. And we've acted on those plans. And every one of the kinds of initiatives that I've talked about are the result of choices, and some tough choices about what we do, because we knew we needed to invest in the organization in a time of difficulty, as well as make sure that we were making savings, concrete savings. So over the past 3 years, we eliminated the operating deficit as planned, and for the first time, March 31st, 2012, which has been a big day we've been working toward, the team, has delivered the first balanced operating position for KGH in 16 years. And there's more, because on top of the $24.3 million of savings that were achieved for the operating budget, we also dug deeper and decided that we needed to deal with the equipment issue. We needed money to invest in the future of KGH. We only had $3 million a year 3 years ago to buy equipment, to purchase technology, and to advance and take care of also what we have. That's simply not enough. A place of our size and complexity needs at least $20 million a year just to be at the starting gate, just to replace. So we've now increased and saved an additional $9 million, and we're up to $12 million a year that we can invest in equipment. And through the past 3 years, the team now going through prioritization processes. We've got new interventional radiology, new equipment for the cardiac cath lab, a new heart-lung machine, new blood glucose monitors on the units for the staff so that information can be more easily dealt with for information about patients. And these are examples where we've been able to make the investments. So a total of over $30 million, $31 million has been achieved in savings. And we knew that we couldn't simply balance the books on the backs of the future. We needed to be setting up KGH for the future. And so also what we've been doing is paying down long-term debt, $2 million a year or so that by 2017 it will be gone. Because we would rather be putting our $500,000 to patient care instead of giving it to the bank on interest. So that is another example. And our health of another big financial health indicator is called working capital, looking at how you can pay your bills. And that's improved by $22 million over the past 3 years. These are the kinds of things that then have allowed us to do the many positive initiatives that I have just described. People ask about what it's been like for the people, our staff at KGH. There's been so much change. I can't think of any area of the hospital that hasn't gone through an incredible amount of change, be it moving around because of the carpets, new protocols, new models of care, new everything. We've asked a lot of people. I've asked a lot of people. And I would say that it's fair to say that there's people that are tired. And it's been a stressful time. And yet I can't tell you how incredible it is when people, I think, connected to the mission about what we're doing and why we're doing it. People understand we need to be stronger, we can be better, and gradually the sense of ownership of we want to be better. We want to be winners. We want to achieve outstanding care always for every patient, every day. And people are starting to come to work with a little more spring in their step. I'd say there's a cautious optimism. You know, it's not all perfect. We still have a lot left to do. But what we've been building is the capacity and the capability to solve problems differently, to deal with things in whole new ways, building relationships even across our own organization as well as others. We now have, through all the various programs and service changes, we actually have about 120 more people in our hospital today working for KGH than we did 3 years ago. And we eliminated 157 full-time equivalent positions. How'd we do that? Well, we have phenomenal human resource staff, managers, and people who have really dedicated themselves to making sure that even if people's jobs changed, like the food services change, where people were no longer working on the lines in the back of the kitchen, but there were jobs created for delivering the food to people on the units. But we gave them training and support and opportunity to be employed at KGH. And most people have taken us up on that, and there's been nobody that has left the organization involuntarily as a result of those changes. We've reduced management and our administrative costs. And I have to say, I've got the utmost thanks and admiration for our many managers in the organization. They've been working and leading incredibly hard to support all the changes in a whole new way. Because every one of those new 120 staff, they're all frontline staff. Because that's what we believe we need to be doing. So while we've been going through all of this, I know there's much, much more to do. But as I said, the capacity of the organization, I think, and the confidence and a bit of the energy is better. And that gives me great hope for the future. Because what's in store for the future? Well, none of us have a crystal ball. But I think one thing we do know for sure is there will continue to be change. There will be a great deal of change in the healthcare system. And I think that's a good thing, because we're not set up the way we need to be. A lot of the healthcare system was designed in the 1950s, and we haven't changed a whole heck of a lot. So working together with our partners, part of the local health integration network team, we're designing and new ways of trying to deliver programs and services. And there are some great examples now through clinical planning initiatives where people are working together to make sure that everybody gets their heart treatments faster at KGH, to make sure that the protocols that we're putting in our hospital for reducing infections are shared with other hospitals within our region as well. So we are contributing to each other's learning so that a patient and family can have that care no matter what and no matter where in the region. There were 156,000 individuals that had an experience at KGH over the past 3 years. We look at a lot of statistics, and I said to the team, but how many people have come to us? How many individuals? That's a lot of people. And so we're so pleased to when I think about it from that perspective, and I think about all the things that people have done, of how they've risen to the occasion to make sure that the experience of every one of those folks has been the best that it can be. And where we haven't hit the mark, because there are many examples still where we have not hit the mark, where we've dropped the ball. Communication is one of the biggest issues when people send us concerns and talk to us. It's a bit about communication, attitude, things that we can control. It's not about you need more money. It's typically about how the overall experience has been, and this is something that we can continue to work on. And so we are working on those things, and we are focusing on how we can continue to be better and better every day. I thought about if the story of KGH was in a bookstore, that 3 years ago, you might have found us maybe, or just, I'm not sure what section, if there's a section for that, but we would have found us in a tough spot. Maybe it wouldn't have been a big reader. But then we've moved to the adventure section, I think, and the self-help section. But I really look at going forward to the future, that I'm really confident that in another 5 years, you go find a book about KGH and it's going to be in the bestseller section. Because there's so many phenomenal things that are going on in the organization, so many great stories to tell. And I've just given you a sample of the things that we're working on, some of the big challenges that we've faced, and some of the things that we're going to continue on working forward. And I look forward and working with you and seeing so many interested and committed people in the community that are here to help support the hospital and support our success on behalf of the patients and families that we serve. We look forward to that bestseller novel on the shelf, and most important, having people share the pride of the changes that have been occurring in the organization. And I'm so grateful to have the opportunity to tell you about it, and I'm really looking forward to answering any questions and comments that you may have. So Thank you very much.